milestone and what is the big deal about it? This question comes, why this sort of a meeting, why celebrate this? I think there is a certain sense to it. I mean, it is not just that to show that we did this or we did that. To a great extent, it is one very important, it shows the way for us to reach the top of the pile. Achieving a milestone is very motivating. And you then have at least another target to set up for the next levels. And this is something we can't be complacent. Like my colleague, Dr. Vijay, keeps saying, you are either rising up or falling down. You are never static on the level. You've got to keep going up or you are dropping down at some point. Very truly. And to be here, there is not one person, it is not particularly some of us at the senior level who have contributed, but it's an entire team which has put in their efforts. And it is time to recognize and appreciate their efforts. I think otherwise this goes unnoticed totally. Very, very important, I think. It's not only the surgeons. There are very many others who have been part of the team. The classical is a story of the symphony. If you have a music, the symphony has to be synchronous. And if one of the elements drops out, then it is no music anymore. So that's the way it is. And it would be a mission incomplete not to say that our chairman here, the SIMS management has been very generous with their support and encouragement all the time over these years. And this has made it the mission possible, that we are able to probably progress periodically and progress gradually over the entire time. Our supporting team, Dr. Raju, we have all been here together now for the 7 years. And it has been a fruitful collaboration and cooperation. And we all, as a department, recognize all your cooperation, support, and adjustment all the time. The entire marketing team, Dr. Ashwin, everyone else was coming. So, it's a big thank you at the beginning to all the members of my own team, Dr. Vijay, all my colleagues around, I think, who have been part of the growing story. And I hope for the upcoming milestones, we are all bundled together. It is a great pride. I can also say that the attrition rate of our own people has been pretty much less. And this also speaks to the environment what we have created in the hospital over the period of time. If it has not been a congenial one, I'm certain that there will be dropouts. There will be a few moments, but then it should not be in a big deal. And that is also a big credit both to the hospital and to the division as such. This was then. 2014, we at the end of 1 year or the 5th, we had certain milestones which we had presented some time ago, which we said 50th surgery, 100th surgery. Now at least it's good to see that we are going to that far corner, halfway down to the 5,000 a year mark, a little less than 5,000 a year mark. And so that's the reason. You have to keep adding milestones and then you probably progress along the way from spot to spot. This was in fact actual board which we used to have outside the orthopedic department with the 4 consultants, other associate consultants. They were pretty much new, they were starting their lives at this point, and today all the people on the right side have moved to the left side in their own mind and purely in one single place. I think that is quite relatable, and this is now 21. We have now broken down into multiple units and departments. It's not, if you say orthopedic surgeon, it looks like a general practitioner today, at least in the tertiary centers like SIMS. Because that's the way the market demands, that's the way the possibility is, that's where the science is. You can't be a master of all until you recognize far ahead of, far before. That to be really competitive, to be really good, and to be probably at the top of the pile, you need to be highly specialized, and that's where our focus is at this time. So presently what we have here is the multiple verticals in the Asian Reconstruction Institute. Predominantly we started off as a Joint Reconstruction Institute, but today it is only constituting 55%, so 60% of the work. All the other sub-orthopedic specialties has taken over. Now within orthopedics itself, we have Dr. Ashok, I think, who has now focused really on endoscopic and robot-assisted procedures. Basically, a technology-intensive options. How good they are, requirement, it's all being validated, but certainly we find a bright future, and that's the way the things are going to go. Second was arthroscopy and sports medicine, which has been started. Dr. Clement is leading the way there. Keyhole endoscopic procedures, so many things open are now brought into the knee. No more incisions. So he's spearheading on the arthroscopic side. Dr. Kalai, our arthroplasty group, again has subspecialized himself in infections, joint infections, which we find is a high influx from other centers. Fortunately, here at SIMS, we are operating at less than 0.5 to 1% of joint infections, less than 0.5. But overall, we do get an influx from other places. secondary to infections, and it needs an intense group approach to this, infectious specialists, physicians, everybody. So Dr. Kalai heads it along with the internist, Dr. Venkat, who has just joined us. He also helps the inputs from the physical side. Then we have the foot and ankle. Dr. Vail is starting. He has started, initiated totally as a separate specialty. Trauma and reconstructions, Dr. Kumar heads the team along with Vail and all others giving us the inputs. And finally, we have the another subdivision, which is spine and deformity corrections. Dr. Apaji is known well, and he is well known in the circles. He's good, along with Venkat, who is the new entrant. He started off. And finally, very important element, which I think we are focusing a little more today, is also the division of clinical research and innovations. I think we have Dr. Shantanu here today with us. Yes. Dr. Shantanu is from the HRM main campus, but he visits us once a week. And so being an orthopedic surgeon himself, and along with him now what we have started looking at is trying to go for a product development. And also in sort of publications and presentations, he gives a great input. So every Wednesday he spends time with all our fellows, who then are able to publish, present many more things, at the same time initiate certain research projects. Because I think the biggest advantage of the SRM is in the main campus you have other sub-faculties, non-orthopedic, non-medical faculties, the inputs of which are extremely essential to do that. With regard to the patients, I mean, this is in fact a small list of all the geographies from where we have attracted the patients. It's not only it's not within the borders. I think a great number even from Europe and USA. I think a predominant credit I would give this to Dr. Vijay, because he has been innovative in terms of maintaining and following up with the unique procedures which were given up at many parts, and which is probably necessary and the only way to go for high intense athletic performances, very young individuals. And this has certainly attracted and have opened eyes for all the global points, something we could capitalize much more upon at this time. So this is the team around us. A big thank you to everybody, right from the nurses, the nursing group, the operating room team. We have the downstairs office in the clinics and the secretarial and the managerial services. The big physical therapy team, which is a very important element, at least orthopedics is concerned. Just recognizing all your contributions. Thank you everybody for bringing this to this point. There have been many firsts and milestones with us, both in terms of academic performance, innovations, introductions, peer recognition and hospital rankings around, with all the inputs and the help we have got from SIMS overall, because otherwise again it would not have been possible, certainly not possible. So AJRI today is well recognized and is on top of the charts in quite a few areas. And once, even though it's easy to go to the top, to maintain the top is extremely difficult. And that's where we are constantly egging ourselves up to maintain these portions. One thing in the downward 11, we started as the AJRI with a couple of our own colleagues, because considered that it will fail in a month, in a year. That's because they said two individuals with the same mind cannot work together, because it is competing within each other. But I always, and both of us insisted that it's never competitive, it is complementary. And it has proved right today, 7 years I think. And the same thing I find with all the other institutions we have, neurosciences, gastric, anesthetic management, craniofacial, aesthetic hand surgeries, hepatobiliary, every department being an institution and group is the way to go in the future, it appears, as the market goes. I think that's the way to go, and we're looking forward. I think we have been on the right trajectory right from the beginning, and we should pursue with this. I think SIMS has shown the way, because we now find other institutions trying to emulate this. And the biggest shortage to do all this is manpower. The rest is available. We have a building, we have a structure, but manpower is the most difficult to achieve and we have to maintain. Just a few points. Institutional success, I think, is a medical and surgical excellence, which we will strive for, we try to perform and we try to excel. Consistent, excellent outcomes, because that is going to be the biggest marketing tool, because they bring the patients. Advanced state of care facility, which is existent here, which is useful. But second important point probably we need to equally focus after a while is a patient experience. Because when you have two similar institutions across, I think it's the patients compare what is the service, how did I feel and what was the outcome. When I entered the hospital, did I feel, it's like a 5-star hotel. Like they say in the 5-star hotels, you will identify which is good or bad from the restrooms we have in the ground floor. If they are clean, you think the whole place is clean. If If that is giving a bad impression, we are done. So that's the way it is. So the patients who come in, I think they need to have seamless navigation at all points, whether they're coming for admission or for discharge or for any process. Once we do that and there's a convenience and a good communication, I think we will immediately score, because on the left side, the professional physicians will make sure that we are giving them the medical excellence, and we will also equally communicate. I think there are two: medical excellence and also all the experience we can gather from the hospitality industry that goes into the hospital. That will make it a total patient holistic experience, which that will be good. So I think our focus looking forward is to be the go-to place for comprehensive and specialist care in this field. But what we find now is gradually, I think we are now bursting at the seams. Quite often, initially it was probably once in a way, then a couple of days in a month, but now more frequent is the fact that we find excessive crowds, people coming, and so suddenly this should not be dissuading to that. So proportionally, I think a time comes when we have to look at the expansion of every aspect of the whole thing. And so in terms of physical space of rooms or anything else, once we do that, I think somebody will focus that will be a great addition to us, and that will help us really looking into it. So constantly improving the outcomes, volume growth in services. We also had to focus on the financial growth of the team by individuals, because we don't want anybody to look anywhere else. Customer satisfaction and optimizing all the processes and services. So like a strategy map if you create, I think that will help us a great deal in doing, and that's what we are trying to target. And just give it over to Vijay for a few minutes. You would like to show what has been the Vision 2030.
Thanks, I'll be very brief. And for me to say where did we look at in 2025, the next 5 years. So again, looking at a more sort of more broader view of why a lot of people did ask us what's special about 150, why not be 200, why not, wasn't 120 significant and all that. I think there's a very important concept here. Some of you might have heard of this book, The Tipping Point, very landmark book, Malcolm Gladwell, he wrote it in 2000 actually. And how little things can make a big difference. So, as we go along, suddenly, we are doing these small things, but suddenly they all add up. That's what's called a tipping point. It applies to many things here. So, it's very hard to push to a point. As the officer welcome, see that, sir, very welcome, sir. So, and then after it reaches a point, then it sort of becomes self-sustaining. And that we have seen, for example, if we take electric cars. Now, maybe 1 or 2 of us here have electric cars. But then, trust me, another 3-4 years, when suddenly it reaches a tipping point, all of us will be driving electric cars. Then it becomes self-sustaining. You don't need to push it anymore. And I think that with 150 surgeries, we feel that we come to a tipping point where patients don't come anymore for either searching for Bose or Surya anymore. They come for orthopedics in SIMS. And once you reach that, they don't come for you at all. And they know that we will refer them, or the right person will operate, the right person will treat. And therefore, it becomes self-sustaining. I think we are reaching that point. People are not coming based on our names, but based on our institutional model. And I think that really is the tipping point. So small things make a big thing. Suddenly it gets a tipping point. Recently I do a lot of talks on, Pata was also talking on health and fitness, and I do about 3-4, now it's online, so a lot of, I do 3-4 a week, and my wife always tells me, why are you wasting time talking to 15 people and 20 people? But suddenly you'll find that one day, health awareness will reach a tipping point. Then everybody will reach that point. So that's the reason, even with a small effort that you make, you have to go to the tipping point, then it will become self-sustaining. I think we have reached the self-sustaining point now. So to put in brief, in 2025, we want to be in the league of our role models. Always our role models have been Shankar Nethralaya and Ganga Hospital, the model of healthcare. And I think we want to be in that league. That's our simple vision of to be. There are many ingredients to that. You have to subspecialize and volume. Once you have subspecialization and volume, quality of output is a given. You have volume and subspecialized output will be guaranteed. In anywhere, the industry, anywhere like that. Yeah. Patient outcomes comparable to the best in the world. That I think is very important, and we now get very VIP patients from US, etc. The best patient outcomes, so that can be easily achievable. But the important thing is must be affordable healthcare along with profitability. Profitability is very important, integral, no question about that. But profitable alone is not this. has to have a strong social relevance to the population. That we believe strongly. Now these two institutions have been centers of true excellence undertaken all over. We also want to be regarded in that league. That's our aim to be in 2025. So it's not just a financial success and healthy numbers. We have grown over the last 6 years, no doubt about that. But not just a question of numbers. We want to believe that we have created value by providing a service needed by the population. Now, not all hospitals, hospitals may be making money, but many hospitals, I don't want to name it, so-called corporate hospitals, they are not providing a service made by it. We don't need 7-star hospitals. Neither do we need free healthcare. What we really need is top-notch, affordable healthcare. And I truly believe that's our vision, to provide affordable, top-notch, best. That's what it is. India does not need free healthcare. We must get out of that thing that we must need free healthcare. Everything must be given free. That's a wrong notion. What we really need is the highest quality healthcare that's affordable. And I'm sure Chairman shares that vision with that, and he will help us to facilitate. That's what our country needs. And I think this is a nation building, nothing short of it. It's not just distributing some money on festivals is what is what is the work that we need. This is nation building. We have to provide a service that's needed. That's so important. Because we draw examples. Some of you may have seen this one. That's of course John Scully was working in PepsiCo when Steve Jobs. Steve Jobs invited him to come and join Apple, and he was very reluctant because he was making money as CEO of Pepsi, a large amount of money. So the famous quote that he said was, "Do you want to sell sugar water for the rest of your life, or do you want to come with me and change the world?" So making money is one part of it, but it has to mean something more than that. Yeah, and that I believe that we are doing by doing a service that's needed by our population. And that's been inspiration for us, and we truly believe that AJRI does provide that. So adding value and affordability. Another good example is Bharat Biotech. Everybody says he makes a lot of money. Krishna Ella, he makes a lot of money, but he has been solely responsible for elimination of many childhood diarrheal problems, Japanese encephalitis by his vaccination. He has brought the price of vaccination so much down that the whole country has benefited beyond measure. So making money, of course, but more than that, he's adding value. So we believe not only we should do medical, surgeries and things, we will add value that we strongly believe in. That's what our vision is for 2025. Now, the CM of Pondy came to our center for having his knee replacement done. So, suppose the CM of Tamil Nadu or the governor, I'm sure they'll come to SIMS for the treatment because that's the reputation that you establish. So once you have that, the top-notch people also come. But again, a low middle class or any set of society must also come and get benefit from the same infrastructure. That's very, very important. That's what we call as affordable healthcare. So you must provide not only for the top-notch, but also from the low strata, the same treatment. The OT must be the same. Room can be different, patient room, but the OT must be the same, staff must be the same, nursing staff have to be the same, equipment has to be the same, implant has to be the same. And that is what we mean by affordable healthcare. That is so same hospital catering to both ends. That's what we mean by affordable healthcare. So I think the secret of success is to be ready when your opportunity comes. So I think we all join together. I think we can achieve that mission by 2025 with the help of our chairman. Thank you very much.